Good afternoon. I would like to start with the fact thanking of the great marketing team of Medcare for providing such environment and situation to be at your service on the occasion of month of October, which is a month of awareness about breast cancer. My name is Godratullah, Nourasne Godratullah. I am a general surgeon, surgical oncologist, trained in Hungary, and both of my post-graduation and all the medical education has been taken in Hungary. I have a European general surgery, Hungarian Board of General Surgery, and also European Board of Breast and Surgical Oncology certificate. I've been working in UAE more than 15 years now. 13 years out of it has been devoted my service to Tawam Hospital, which is one of the leading hospitals in fighting cancer. And I've been having the honor joining Medcare Al Safa Park almost 3 years now. Today's occasion is coinciding with the beginning of the month of October, which is, as I mentioned, it's awareness about the breast cancer. Breast cancer is, we can say, it's a frequent thing. So the incidence of breast cancer is something that is affecting many families. The reason is that because females are the core of our society. And the importance of taking care of females, or mothers, sisters, daughters, cousins, is lying in the fact that if a woman is not well, then the whole society somehow will not be well. I would like to mention that breast cancer is one of the most common cancer among females, even in this country where we live in. As per statistic, every 8, so out of 9 or 8, one female is expected to face breast cancer between age 20 and 70 years. These are international facts. There are some plus or minus in this information, but this reflects the severity and the significance of this disease. 250,000 of new incidents of cancers are seen almost worldwide. Most of the information are coming from US, definitely. And in this part of the world also, this is something very frequent. We know, let's say around the last information that I was reading was that about a year ago, almost 4,700 of new cancer cases have been here in UAE, and more than 4,000 of it was breast cancer. This much I think is enough about the importance. But how can we go about this? I mean, what can we do if not to face this, or if we face it, how are we going to solve that? Unfortunately, there is no prevention exactly which can be directed to breast cancer. We don't know. That's why the importance of screening is important. I mean, the importance is really cannot be forgotten. Screening is the only way to detect all the diseases, breast cancer diseases, right on time at the beginning, so we can fight it and overcome the fight almost 100%. So early detection and screening is a savior. It is important to take part and to be aware of this and to aware others or females, members of society, to do the screening, because screening is lifesaver. The screening is done for not all the females, definitely. The screening starts at the age of 40, and the cutoff on the other end is almost 70 or 75, depending on the countries and some guidelines which are sometimes locally modified. Screening means doing a mammogram, because that's something that can be reproduced, do it again and again, and get the same result. This is the actual definition of the screening test. The other thing which is used in addition to mammogram is ultrasound, which is non-invasive, fast technique, and these two are actually completing each other, because there are some changes sometimes might be missed while doing a mammogram, and also in dealing with dense breast, mammogram has some shortcomings which can be compensated by using an ultrasound, and in some cases, and certain cases also, using MRI is a method that is suitable to do this. I guess with this introduction, we have come to a conclusion that why it's important to do this. These facilities nowadays are available in every country, almost every country, and there is no need to highlight that Dubai is one of the countries, the towns, or UAE is one of the countries that we have the best of almost everything here. So let's use these facilities here and help each other. I think I would like to ask Kima from our marketing to join this conversation.
Yes, Doctor. Thank you so much, first of all, Doctor, for joining us for this very important topic. I think, like you said, with October, just starting tomorrow, this is a very important time to actually create awareness about breast cancer and the importance of it. A few of the questions that we would want to probably take your expert advice on is, can people die from stage 1 of breast cancer, or it's something that does not happen?
A very interesting question. The answer is it shouldn't, or no one should die from this, because if it's detected, it's almost 100% curable things.
Okay.
So the idea is that breast cancer is something like, today we look at this like a chronic disease, like diabetes, like hypertension. So something we have to be aware of it and detect it on time, and there is a way to deal with it. So if detected early on time, it's almost 100% curable.
Do you see a lot of patients coming with stage 1, or is it when they reach stage 2 or 3, perhaps, that's when they actually come to you?
For the last few years, what we have been facing here, that patients who come and seek help, they are in more advanced stages, like comparing to Europe or other countries, where they apply and they use this screening things.
Okay.
So, but there is small shift in that curve now, as more and more people, more patients are using this screening, and if there is anything which is you cannot physically palpate it or notice it, will be appear on the images.
Okay. Going ahead with your suggestion, if a woman finds a lump around her breast, can she decide if it's cancerous or not? Is there a way or some kind of a sign for her to realize that, yes, this is cancer and I need to go see my oncologist or my general surgeon?
Lumps are not equal to cancer.
Okay.
So there is no way that physically touching yourself, palpating yourself, and say this is cancer or not. There is no way of that. So, and let me mention that. So, most of the lumps that are found in breast, they are not cancer, not necessarily cancer.
Okay.
And when we decide to do a biopsy from the breast, it doesn't mean we are biopsying from the cancer. No, we want to do a biopsy from a change to exclude the worst thing, which is cancer.
Okay.
And one more thing, let me add, is that not all the lumps are cancers even. So what we do is that sometimes there are lumps which are absolutely benign and we don't even touch them. But sometimes there are some changes. If you leave it, it might go to cancer. So we call this precancerous
Okay.
Precancerous lumps or lesions.
Okay.
As you know, cancer is a spectrum of a change of cells from a normal to
Cancer.
abnormal cancer, which is actually non-controlled, uncontrolled growth of the cells. Abnormal growth of cell, which is not cannot be controlled
Okay.
by the body for
So
so
you-
many reasons.
So you're saying sometimes these benign lumps can lead to cancerous lumps as well. Sometimes, not.
No,
not-
those are not benigns. I
Okay,
would
they're
say.
precancerous.
So some benigns, they will give you some additional risk factor possibility for changing or
Okay.
transforming into something bad.
Okay. 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 Doctor, you mentioned 1 in 8 or 9 women go through cancer. Is there a reason for the increase of this number? Is it because there's more awareness, so more people are getting checked, or is it you've seen this increase in number over time?
No, this number is not something that has been changing much for
Okay.
the last few years. At the beginning, in like 1980 something, when the screening started, definitely any screening test when it's actually introduced into society, it will increase the numbers because we're testing more. We see a lot of things. We haven't seen things.
Okay.
And just like somebody who doesn't see well and gets a nice eyes glass, then you see a lot of things.
Okay.
But it doesn't mean it has not been there. Or the numbers increase. It has been there. The same thing would see it more.
Okay.
But there are some areas, so-called inequalities. I mean, geographically, there are some places in the world people might have more. They are more, susceptible to this one. Okay, and there are some in terms of genders. Definitely, we know that.
Yes.
Or ages. You know,
Okay.
we have risk factors for breast cancers.
Okay.
You know that the first risk factor is what? It's female. It means what? It means the male can get it also. That's it. That's another thing, but less than 1%.
Oh, less than 1% in
Yeah,
males.
so we have that. So don't forget the female. It's the biggest factor actually. The other thing is aging. So
Okay.
if you look at the statistic in Europe and America, this is a disease more of a for elder population. It has been at least like this for the last few years. There has been a change, a shift actually. What we know, for example, in UAE, the average age for having breast cancer is almost around 10 years lower than average age for compared to other countries.
Okay.
Although similar thing is happening in Hungary, because where's my background,
Yeah.
I've been, so I know the statistics over there. These are, but what are really the cause for this still is not known. There are a lot of studies going on, but in general, when we're talking about cancer, we talk about nature and nurture. So
Okay.
it means what we bring with us as genetic, as what's inside of us, and what are the factors that we add to this one. So we are exposed to a lot of carcinogenic things, okay? So what we eat, what's around us, radiation, and I can name many other factors.
Yeah.
So in combination of these two, it will give an output, which we
give an
really
output.
don't know where to.
You mentioned one of the reasons is being a female, but there are other reasons like family history. So, for example, if somebody's family has a history of breast cancer, is there a way for their offsprings to prevent it for them to happen? Is there any suggestion or any measures they can take by themselves?
No. Having a family member having cancer, it doesn't mean this is just like a contagious thing or genetically 100% is going to go to their offspring. No, that's not true.
Okay.
But it just raised the fact of awareness that these individuals, these members should be more careful. So to give you an example, if in a family, a lady at the age of 45 gets a cancer, screening for that person should not start at 40. It should be on 10 years before the actual age of having cancer. So 45 is going to be so screening that particular individual starts at 35, 10 years. So, but definitely there will be genetic counseling. Okay, so it's more complicated that here. That's why it's important to sit with the doctors, to sit with us, and then we'll have all the time of the world to explain to them to exactly. So they should not, I mean, we should not be afraid of the fact. We should not be afraid of the word cancer. If I repeat the word cancer 200 times in a minute, I'm not going to get cancer. Okay.
Yeah.
So, and cancer at early stage, again, I'm going to emphasize, is treatable 100%.
It's treatable, so
100%.
screening is important then. You mentioned about the age of breast cancer. Have you seen any person or any patient with younger than 20 years getting breast cancer?
There are cases, definitely. So, by definition in literature, when we say this in breast cancer, young woman, anyone who is below 40, the cutoff is 40, is called them young woman. So, young breast cancer in young woman is below 40. But actually, yes, I've seen patients who are 16, 15, 17, even teenagers. It could happen.
It could happen too.
Happen.
Okay.
Yeah.
So, I mean, how do they know about it? Do they go in for a mammogram as well? How can they, like you said, getting that on stage 1? And
these are patients or individual who, for knowing the fact of family background, positivity with cancer, they start early checkup, ultrasound, and other methods like MRI. So this is because of being aware of the fact they might have it. So it runs in the family. That's why they are more aware. The second thing is that these people, most of the time, they come either with a lump, they feel a lump which is there, or they have nipple discharges. As we know, the cancer, it shows itself in many ways.
yeah.
Some of them are only detected on images, which is like calcifications, and you have a lump, changes in the architecture of the breast. These are something which is, there are some specific changes on images which puts any lesion towards suspicious for cancer or not. This is the thing.
Okay.
The other thing is physical thing. Physical things are, and here I would like to mention something that, so I would say that pain, in 70-80% of ladies, they will have some sort of pain in their breast. Pain is not cancer per se, though it can very, very rarely might be a part of it. It's either coincidental or in the later stages. Rarely we see patients who come just for pain and have cancer. Okay. So this is, if you have pain, don't worry about it. Okay. Just check yourself. Okay. So that should be a topic, another session maybe. What is pain in breast and how we're going to go about it. I was mentioning about, so if you have a lump, you feel hardness, you feel redness, something is itching, you have nipple discharge, you have some sort of asymmetry, the skin is like there is some change of the skin. Okay. These are the signs that should raise the fact that we need to look for an expert opinion.
Okay, all right. One of the other questions, though, you spoke about precancerous cells and then how they develop into cancerous cells. Is there some triggers that trigger these precancerous cells to move into cancerous cells, something environment or eating or something of that sort?
Carcinogenic effect of what we eat definitely is known. I'm sure there are hundreds of material which has been considered carcinogenic. But if you want to concentrate what to eat not to get cancer, I mean, we're going to be lost in details.
Okay.
My philosophy is like having a healthy life is not equal to going to extreme, not to have something at all and have only something. Just you're alone and you want to do what you call a seesaw. You cannot be on this side, you cannot be on that side. So you have to be in the middle. So to stay safe, you have to stay in the middle. Definitely there are guidelines and protocols and suggestions what to eat. Today, I think the internet's full of many information, which is good in a way, but then the other way is that this Dr. Google thing complicates a little bit our life.
It kind of makes you think of the most extreme cases, yes. So you told us about how 40 plus can go in for a mammogram screening. How early can a woman or a girl go in for an ultrasound? At what age can they start, having their ultrasound screenings?
If you don't have any familiar background, whenever you have any problem, any complaint, otherwise, we just don't go because I want to do a checkup. I don't think that's not a good philosophy. As I told you, most of the patients come initially for pain,
Okay.
but they live happily.
Okay.
Because we explain to them, we exclude that there is nothing. Once you do this, and reassurance.
Okay.
80-90% of patients, after 1 or 2 visits, they're fine.
They're fine.
It's important to be reassured, definitely.
Okay. And these mammograms, how often should a woman do them? It should be every year, every 2 years?
Called annual, every year. This is what we practice here. In some countries, they do it every 2 years, but that's kind of a modified local guidelines here.
Okay.
And the idea why we start at age of 40 is density of the breast. So because if you want to take a picture of a tissue, because there's rays going, X-rays through it, if something dense, you will not get any picture because you need some contrast between, so something to penetrate through the tissue and make a contrast. You see that if the breast is dense, then you won't get much information. That's why ultrasound comes into place, or MRI.
Okay.
Yeah.
So that's one new thing. Also, one question, how often do you see the reoccurrence? So a woman must have gone through stage 1 of breast cancer, it's treated, it's cured. How often does it come back? And what are the precautions that the lady should take in order for it not to come back?
There are guidelines for post-operative follow-up. The patient, they should do that. So every 3 months and 6 months for physical examination and images for the first 3 years, and then we take it annually until 5 years, because we talk about 5 years survival. 5 years survival, you can say the stage 1 breast cancer disease is 5 years survival is more than 90%. It means these people will die from something else, not breast cancer. So it means 90%. It means complete cure, complete treatment, complete cure. Please.
Yes. No. And one of the last questions, is it true if somebody is completely fit, physically fit, or will not get breast cancer?
No. In one sentence, the chance is less because health is equally related to having a good physical condition and having a healthy body, but there is no
guarantee.
No guarantee about this one, as we see. So, but we cannot build our life on exceptions. Definitely, risk factors which are known, they are important. We know that they are important. They play a big role. Okay, and I think things are beyond this thing. One of other thing that I wanted to say that these days, today's world it's about NDT and multidisciplinary approach to most of the patients now. When it comes to cancer, that's definitely is a must. That means that so a radiation oncology, a medical oncologist, a surgeon, a pathologist, and let's say a plastic surgeon, all should be in one team. Look at one patient to see, because this thing has many aspects, and one eye is not enough for this one. And studies have shown those who are treated in centers by the specialists, those who really know what they're doing and they work as a teamwork, they have a better outcome, definitely. And where I am working in Safa, definitely we have the facilities to provide help. Start from consultation and doing the necessity examination, including biopsy, and if it's needed, surgery. This is always combined with getting consultation from our plastic team, namely Dr. Jamil is here, my colleague and friend, that we talk about cases together. So, and we offer the best needed thing. One last thing also, that this October, in every October, definitely we try to provide, actually, the hospital management and the marketing also, you're aware of that, to get an easier access to these facilities for those who want to do the screening, and this means definitely economy-wise also, so to make it easier and faster.
Yeah.
So we are there anytime.
Yes.
At your service.
We are having special offers for the month of October as well for the breast screening. So it, like you said, it's easier for everybody to access and, you know, actually get themselves checked and help us avoid spreading of this, you know, scary cancerous thing. Anyways, doctor, thank you so much for your time and being here with us for this very important topic. We really appreciate your presence, and I'm sure everybody who's listening to us would have benefited from it. Thank you so much, Doctor.
I'm very thankful for this opportunity as well. I'm sure there are a lot of thoughts and questions not been answered, but I'm available everywhere, on the net, in the hospital, and everywhere. Thank you so much.
Thank you, Doctor. Thank you so much. Thank you.